This video discusses the basal ganglia and the loops and pathways that will allow the basal ganglia to have an impact on the motor cortex as well as movement. So let's begin by defining those loops and pathways. The first loop that we should look at is the direct loop. Second, the indirect loop. And then we have two primary pathways. We have the dopaminergic, okay, and the cholinergic. All right, and let's just make sure our spelling is correct here. So to define the direct loop, we should start with the understanding of its purpose. And its purpose is to be excitatory. Now, we should define the key players. Key players for the entire system of the basal ganglia and loops and pathways will begin with the motor cortex. Motor cortex, naturally not being part of the basal ganglia, is the primary motor center that feeds information into the basal ganglia. This information passes through what's often known as the gatekeeper of the basal ganglia, which is the striatum. And the striatum actually consists of the caudate nucleus and the putamen. Okay. Let's just make that a little bit more clear. So the second key player of the basal ganglia will be our globus pallidus. And the third, our thalamus. So the direct loop itself is a pathway from the motor cortex to the striatum, to the globus pallidus, and ultimately to the thalamus. But before we can define that, let's first talk about the tasks of each of the ganglia. First, the thalamus. The thalamus is responsible for transmitting positive or excitatory information to the motor cortex. The globus pallidus is responsible for transmitting negative or inhibitory information. It does this through the use of GABA, which is a negative neurotransmitter. So we can come back and define these with arrows. And the thalamus would send positive information or excitatory information to the motor cortex. Now let's define that with the color green for positive. Okay. Now, the globus pallidus, under normal circumstances, it will emit the negative neurotransmitter GABA, which will therefore inhibit the thalamus. And for the negative, let's keep that red. Okay. However, in order for this normal activity to occur, the globus pallidus needs to be modulated. The direct loop is modulated through the gatekeeper, which is the striatum. So let's come back to the beginning, which is the motor cortex. The motor cortex sends excitatory information to the striatum, thus exciting the striatum and encouraging it to do its job, which is to release the negative neurotransmitter, GABA. Okay. So we can copy this arrow from here, and we see that we have the striatum sending the neurotransmitter GABA to the globus pallidus. Therefore, the striatum is inhibiting the globus pallidus. The globus pallidus, again, its normal job is to inhibit the thalamus. So the direct loop is actually a loop where the striatum is inhibiting the globus pallidus from inhibiting the thalamus. So ultimately, it allows the thalamus to run free and overexcite the motor cortex. And that's why the direct loop is considered excitatory. So to summarize, we can summarize this loop by saying the striatum inhibits the globus pallidus from inhibiting the thalamus. Ultimately, leaving us with the thalamus exciting the motor cortex. Okay. Now that's our direct loop. So let's encapsulate our direct loop here, just to keep the color coding. As an excitatory, we'll encapsulate that with green to define the excitatory loop. Now the next loop of modulation here is going to be our indirect loop. Our indirect loop is defined as inhibitory. Okay. So the inhibitory indirect loop will require its own key player. The key player at hand here is our subthalamic nuclei. Our subthalamic nuclei is able to utilize the neurotransmitter glutamate, which happens to be positive. So under normal circumstances, when the subthalamic nuclei fires, it transmits a positive or excitatory charge, and it has an interaction for our purposes to the globus pallidus. So let's define that again as being positive via the use of glutamate. Now that's the key player. So that key player, by bringing the positive charge or the positive input to the globus pallidus, allows the globus pallidus to be active, ultimately overpowering the striatum. Therefore, the globus pallidus being active transmits GABA, which inhibits the thalamus, and ultimately reduces the amount of excitatory information coming from the thalamus to the motor cortex, therefore defining our indirect loop as inhibitory. So again, we can summarize this as defining the subthalamic nucleus excites the globus pallidus, which then inhibits the thalamus, ultimately leaving the thalamus to be unable to excite the motor cortex. Again, leaving us with a negative or inhibitory loop. So let's define that with red. And there we have our indirect inhibitory loop. Now, in a normal occurrence, the indirect loop will dominate over the direct loop, thus giving us the thalamic control over the motor cortex and inhibiting excessive movement or excessive motion. We continue on through the basal ganglia loops and pathways. We move on to the dopaminergic pathway. Okay, so let's define that as our pathway. And the dopaminergic pathway utilizes dopamine, which is a neurotransmitter that can have a positive or a negative effect depending on what it's stimulating. However, the dopaminergic pathway itself has an overall excitatory effect on the motor cortex. So let's take us through that. Again, in order for the pathway to work, we have to have our key player. In this case, our key player is the substantia nigra. Substantia nigra, as we stated, can utilize the neurotransmitter dopamine, which is positive or negative. Now, dopamine in this case acts on two separate areas. The complications of the striatum really define exactly where the dopamine will act. But for our purposes, we'll keep it simple and we'll define the dopamine's impacts on the striatum directly, that being the direct loop, and we'll also define its impact to the globus pallidus essentially through the direct loop, the indirect loop. So we'll stop that arrow a little bit shorter. Okay. Now the impact on the striatum. The striatum receives dopamine as a positive neurotransmitter, whereas the indirect loop, or the globus pallidus, receives dopamine as a negative neurotransmitter. Now, just for clarity and for use during a later discussion, let's go ahead and add a few arrows here to demonstrate the multiple, the amount of dopamine that is being released. Okay, and we'll do the same here. We'll give 4 positive and 4 negative. Okay, so overall, the dopaminergic pathway releasing dopamine has the excitatory impact on the striatum and the inhibitory impact on the globus pallidus, ultimately resulting in the same thing, which will be the inhibition of the globus pallidus. And to take that back, let's go along the pathway. The positive dopamine comes from the substantia nigra into the striatum, which encourages the striatum to do its job, which is to release GABA and ultimately inhibit the globus pallidus. So directly through the direct loop, substantia nigra inhibits the globus pallidus. Now indirectly, the substantia nigra releases dopamine as well, which has a negative impact on the globus pallidus, ultimately inhibiting the globus pallidus through the indirect loop. So at the end of the day, we're left with an inhibited globus pallidus from both the striatum as well as the substantia nigra, which overpowers the indirect loop or the subthalamic nuclei and ultimately inhibits globus pallidus from inhibiting thalamus, leaving the thalamus unchecked and being allowed to stimulate the motor cortex. So to summarize, we have the substantia nigra exciting the striatum to inhibit the globus pallidus and increase the direct loop. Now on the other side, the substantia nigra will inhibit the globus pallidus, directly reducing the indirect loop. Okay? Leaving us with an overall net positive. So we can encapsulate our dopaminergic pathway in green to demonstrate the positive. Okay, the next piece is our cholinergic pathway. Now the cholinergic pathway utilizes acetylcholine. And the cholinergic pathway is in direct opposition to the dopaminergic pathway. Okay, so let's make sure our dopaminergic pathway is defined here properly with green. And we've already stated that the cholinergic pathway opposes dopaminergic, so we can come right out of the gates understanding that it is going to be an inhibitory pathway. Okay. As with everywhere else in the basal ganglia loops and pathways, we need our key player. Now our key player here is a little bit harder to define in that it is not a separate piece. It is the striatum itself. So let's come on up top and just grab hold of our striatum and we'll draw a line down into our cholinergic pathway so we can clearly understand where this is occurring. But to be clear, the cholinergic pathway occurs within the striatum. Okay. So if we have our striatum here, let's not forget that the striatum is composed of the caudate nucleus and the putamen. Now, for our purposes, it's not necessary to delve into the intricacies of the caudate nucleus and the putamen. However, we should take note that the caudate nucleus and the putamen will have loops within themselves, which will ultimately modulate the release of acetylcholine. So making that assumption, we can take one slightly deeper look at where the acetylcholine or the cholinergic pathway occurs. More specifically than the striatum, we can define it as occurring in the interneurons. Okay. Acetylcholine, as we know, is a positive neurotransmitter. Okay. Positive neurotransmitter. And in these circumstances, it will release its positive actions on the indirect loop. So ultimately having a positive impact on the indirect loop. But we'll also make the assumption and really just define the activity where the acetylcholine will have a negative or inhibitory impact on the direct loop. So without getting into too much detail at this point, we can summarize by saying that the interneurons within the striatum will release acetylcholine. Acetylcholine will have an inhibitory impact on the direct loop. Let's just remind ourselves that the direct loop is excitatory. And acetylcholine will then also have an excitatory impact on the indirect loop. And we'll remind ourselves here that the indirect loop is inhibitory. So we can surmise that if we have an inhibitory effect on the direct loop, we are taking away the excitement. And if we're exciting the inhibitory loop, we will ultimately have a net negative or inhibitory effect. Okay. So as you can see, the dopaminergic pathway and the cholinergic pathway can actually balance one another out. Now, what does this all mean to us? So let's just begin by cleaning up a little bit. So we have the clear definitions that this is our basal ganglia loop and pathways, direct loop, indirect loop, dopaminergic pathway, and cholinergic pathway. So to take this a little bit deeper, what we'll do is we'll copy this sheet here twice. And in our first copy, we will label right across the top as Parkinson's disease. Okay, so as we know, Parkinson's disease is a disease that impacts the dopaminergic pathway by reducing the amount of dopamine that we have available. Therefore, impacting our motor cortex in a negative manner. So let's take us through that. If we look at our substantia nigra releasing our dopamine, the substantia nigra does not determine whether the dopamine is positive or negative. In fact, the dopamine is always just dopamine. It's the receptors that will define positive or negative. So with somebody who has Parkinson's, by the time they have any symptoms, they're generally at 80% loss of dopamine. So if we were to come over and take away approximately 80% of our dopamine, we are now left with much less information from the substantia nigra into the direct loop of the striatum, and less information from the substantia nigra inhibiting the globus pallidus, ultimately significantly reducing our ability to use a dopaminergic pathway as an excitatory pathway, thus allowing the indirect loop as well as the cholinergic loop to dominate, ultimately inhibiting or reducing the motor cortex and its output. So Parkinson's disease will then be defined as inhibiting motion. And with our primary symptoms of Parkinson's disease, that would make perfect sense in that we have bradykinesia and rigidity. Okay? Now, that occurs at the substantia nigra. So, just to be clear, we will block out our substantia nigra, demonstrating that it is no longer functioning, and ultimately not allowing this pathway to be as excitatory as we might want it to be. So I'll have to take away the color there. Okay. And that defines Parkinson's disease. Now the next disease that we can define here is Huntington's. Huntington's disease is actually not defined by a reduction in one of the neurotransmitters per se. However, it is defined by a reduction in the globus pallidus's ability to function. So we can signify that by blocking our globus pallidus here, thus taking away the ability for the globus pallidus to transmit the negative GABA, and ultimately taking away its ability to inhibit the thalamus. Therefore, Huntington's disease will allow the thalamus to run unchecked in an excitatory component, primarily allowing the direct loop only to act, the thalamus directly on the motor cortex, with little input coming through the striatum and the globus pallidus, ultimately negating all of the rest of our loops and pathways. Therefore, we can define Huntington's disease as excitatory with excessive movements, which present as dyskinesias. Now, naturally, we're simplifying the mechanism of action, but overall, we can come to the summary. Now, to take one step back to Parkinson's disease, if we look a little bit closer, we see that the substantia nigra has now been negatively impacted, and the release of dopamine has been reduced significantly. Well, that reduction of dopamine takes away the ability to reduce the indirect loop, therefore allowing the indirect loop to easily inhibit the motor cortex. However, the second piece of that is the cholinergic pathway. Without the opposition from the dopaminergic pathway, the unopposed cholinergic pathway will release and have extra acetylcholine, thus giving us our secondary symptoms of Parkinson's, which are related to the acetylcholine, most clearly defined as tremor. Now, for a brief, in under 1 minute, basal ganglia review, we will start with our loops and our pathways. So we have direct loop, which is excitatory, indirect loop, which is inhibitory, dopaminergic pathway, which is excitatory, and cholinergic, which is inhibitory. To come to our direct loop, we must look at the key players, our motor cortex, striatum, globus pallidus, and thalamus. To summarize our direct loop, the direct loop is the striatum inhibiting the globus pallidus from inhibiting the thalamus, ultimately leaving the thalamus to excite the motor cortex, resulting in excessive excitation. The indirect loop, being inhibitory, requires a key player of the subthalamic nuclei. Subthalamic nuclei releases glutamate, which has a excitation on the globus pallidus, which causes it to inhibit the thalamus, resulting in a reduced motor excitation on the motor cortex, thus making our indirect loop inhibitory. Then we have our pathways, which will control the basal ganglia and control the motor cortex ultimately. Dopaminergic pathway uses dopamine. It acts through the substantia nigra, which will then release dopamine that will have an effect on the direct loop through the striatum, the indirect loop, for our purposes, through the globus pallidus, and ultimately having the same purpose, which is inhibiting the globus pallidus from inhibiting the thalamus and leaving us with increased excitation. The final pathway of our discussion is the cholinergic pathway, which acts through acetylcholine, and it acts and occurs within the striatum. This specifically occurs in the interneurons of the striatum, where acetylcholine is released, ultimately having an inhibitory effect on the direct loop and an excitatory effect on the indirect loop, therefore inhibiting the excitation, activating the inhibition, ultimately leaving us with an inhibitory amount of information going to the motor cortex, leaving us with reduced motion.